Hello, everyone, and welcome back to season 2 of Transform 360, where science meets compassion and we explore wellness from a whole person perspective. I'm your host, Sabar Shad, a founder, pharmacist, and a mental health advocate. Today, we are exploring a topic that resonates with so many of us. If you have ever felt rushed during an appointment, unheard as a patient, or emotionally exhausted as a provider, this episode is for you. Today, we are talking about direct primary care or DPC and what it really looks like when clinicians step out of their traditional insurance based model to build care that's more human, sustainable, and aligned with their values. And I'm so excited to welcome Monica McKittrick-Smith to the show. Monica is a nurse practitioner, an entrepreneur, and the founder of Impact Family Wellness, a direct primary care practice in Texas. After experiencing firsthand how broken the traditional healthcare can be, she ditched the insurance, built a DPC practice, and never looked back. Monica now helps patients get the kind of care they actually want and helps clinicians build sustainable practices that they truly enjoy. In addition to this, she is also an author of DPC, Dream Job or Total Disaster, and the creator of the DPC formula, where she teaches providers how to escape burnout and build care models that work for real life. Monica, thank you so much for being here. I'm so excited for our discussion today.
Yeah, that was a great intro. I feel like, you just told the world all the things they need to know.
Of course, yeah, thank you. I'm so excited for this. Before we dive into the nuts and bolts of DPC, I would love to start with your story because big shifts like these they don't happen overnight. And I know you from when you started your practice in Cedar Park, and now it just makes I'm so happy like how you guys have grown. So, what was the moment or the series of events that when you realized the traditional healthcare model isn't working or isn't sustainable for you?
Yeah, I think I realized how awful it was my first day as a nurse practitioner. I was 25 and I had become an NP and I was like, this is amazing. I'm finally going to do what I want. And then I spent the whole day doing paperwork instead of actually talking to patients. And that was my first, like, oh, this is what this job really is. I had no idea. So I did that for 10 years. I worked in the insurance based world. I treated my patients like cattle. I did the best I could, but I was like the Wizard of Oz. I would tell my patients, hey, let's try this. And if it doesn't work, call me. And they would call. But they could not get through the receptionist. They could not get through the medical assistant. They could not get through the nurse. I was literally like in the back behind a curtain where nobody could talk to me. And then my patients would show up 6 weeks later because that was my first available appointment. And I'd be like, oh, how are you doing? Thinking everything must be fine because they haven't called me for 6 months. And turns out they were miserable. And so then they're mad at me because they couldn't get through, even though I had no idea. And it was terrible. And so after 10 years, I was like, what am I going to do with my life? And so we were actually relocating from New Mexico to Texas. And I was like, maybe I'll do primary care. Maybe I'll go back to orthopedics. I'm not sure. And then a Facebook ad came to me and said, primary care physician takes home $400,000 a year and is home in time for dinner. I was like, well, that's a lie. That clickbait worked like a charm. So I clicked on it and it was all about this concept of direct primary care. And I was like, well, this sounds interesting. So I did a ton of research, watched every YouTube thing I could. And back then there wasn't a ton on it. This was 7 years ago. And so there wasn't a lot of info on DPC, but there were about 600 practices across the country that were doing this. I was like, I might be able to do this. So I went to my husband who has an MBA and I said, husband, I'm going to open my own practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. Girl, he straight up laughed in my face. He's like, that's not real life, Monica. Nice try. You can maybe have 2 or 3 of those, but there's no way you can have all 4. I was like, oh, but I can. Challenge accepted. So I Googled how to write a business plan because, ChatGPT was not a thing back then. Wrote a business plan, took it to my husband, said, I need $20,000 and I'm not going to get paid for 6 months, but I'm going to do this. And he was like, okay. So my plan was really to give myself a job that I didn't hate, then Fast forward 7 years later, I now have a business that has 3 locations. I have 8 nurse practitioners that work for me. I actually don't see patients anymore. I just am the CEO, but I love what we do. We really do take care of human beings. So it finally allowed me to do what I went to school for 9 years to do. And that was to create relationships with my patients and do what was best for them, not what their insurance company told me to do.
That's amazing. And thank you for sharing that. And when you were sharing your story, what really stood out to me was the courage that you finally had to admit that something wasn't working. And then you took that giant leap of faith.
Yeah, and I was in a very fortunate situation where my husband made enough money that I could do that. And I do know that that is a barrier for a lot of healthcare providers because they can't go without a salary for 6 months. And so the more that direct primary care becomes common knowledge and everybody is doing it, the less that barrier to entry will be because those practices can grow much faster.
That's true. That's good. Okay. Let's zoom out for a moment because DPC is still unfamiliar to a lot of people, including a lot of healthcare workers, right? And
Absolutely.
a lot of people know Texas became the 13th state to enact the DPC care legislation on May 28, 2015. And according to Hint Health, there has been approximately 240% increase in DPC membership in the US from 2017 to 2021. And now I'm sure it has gone even more than that. For
Mhm.
someone who's hearing the DPC word for the very first time, whether they're a patient or a clinician, how do you explain what it is and what makes it fundamentally different?
Sure. So DPC is basically membership based healthcare. So we don't process insurance claims, but we take patients with or without insurance. It doesn't matter. So the best way I've come up to describe it is like Netflix for your doctor or affordable concierge. So in most offices, it's a monthly fee that's less than $100 a month, and it gives you unlimited access to the office. So there's no copays, there's no office visit fees. You can come in as many times as you want. There's no extra charge. Oftentimes, it'll include your annual physical, sometimes annual physical lab work. Every office is a little bit different. But bottom line is, it's all about creating a relationship with your provider and getting rid of the barriers to healthcare. So, getting appointments, being able to see the same provider over and over, having that relationship with them, knowing the cost up front, those are all barriers to our very broken healthcare system. The fact that you can come into a direct primary care office and not sit in the waiting room for 30 to 45 minutes because we see so many less patients. And so it's really about relationships and making sure that patients get the care they need. There's zero incentive for any of us to write prescriptions or order labs or do any sort of imaging. We really get to do what's best for the patient. We also make it as affordable as we can. So we have contracts with outside vendors to make sure that we get things at a much cheaper cost. And we're advocates for our patients. Just like a plumber doesn't expect me to know how to go to Home Depot and find the parts and make the things to fix my toilet, I shouldn't expect my patients to know how to navigate this really broken system. And so if they do need care outside the office, I'm here to help them navigate that system. Where is their prescription going to be the cheapest? Who's the best specialist to see who's not going to rip them off? And so we have a lot of patients who have insurance and are just really done with the system that won't answer their phone calls. And I think one of the best things about DPC is the direct access to your provider. So I don't have a single medical assistant or nurse that works for me. We are all nurse practitioners. I have a few administrative staff that do back end stuff and answer the phone, but you get a response from your provider in 2 hours instead of 3 days. The number of times I've gone on a patient portal and sent a message to a clinician and they're like, okay, we got your message. We'll respond within 72 hours. I'm like, I might be dead by then. Like, what do you mean? And so it's all about accessibility. We have same day appointments. You can schedule your appointment online. Like we just try to make things super simple, affordable, accessible, personalized, all the things that healthcare isn't. That's what
Yeah,
direct primary care is.
that's amazing. And I would love to for you to explain a little bit that it's not just like people would come in and see the provider if they have maybe an annual physical done. What other services does your practice offer so people at least can they can have an idea of what DPC can offer?
Yeah, so we do all of your primary and urgent care stuff. So whether that's a sick visit, so you think you have the flu, COVID, strep, upper respiratory infection, sinus infection, some viral thing, instead of waiting 5 days, come in and get it checked out right? Because it's not going to cost you anything. We also do a lot of in-office procedures. So we put in and remove IUDs, we put in and remove Nexplanons, we take out ingrown toenails, we cut off moles, we cut off skin dags, we get rid of abscesses. We can deal with minor sprains, strains, and fractures. We do a lot of suturing. So if you cut yourself while you're making dinner, we're here to help. But then we also do all of the preventative stuff as well as chronic illnesses. So we treat diabetes, high blood pressure, cholesterol problems, depression. We do birth control, all the things in between. But ultimately, our biggest thing is prevention, because I would much rather know today if you are on the road to becoming diabetic as opposed to waiting until you are diabetic. And so we're really into having those appointments, even if you feel fine, because we need to talk about all the things, from your stress to your sleep, to your nutrition, to your body movement. Those are the real things that affect your health. I'm not here to wait for you to develop high blood pressure or to develop adrenal fatigue because you've been super stressed out. We're going to talk about your stress, and we're going to talk about how we can manage that, not necessarily with a pill, because I think we rely a little too much on pills. Like, the pharmaceutical world has its place, but so much of what we do is just put Band-Aids on things. And it's like, you have a lot of more control over your health than you think you do. But also doing screenings. I mean, there is a blood test for ovarian cancer that is just not recommended enough. And it's because that test is really expensive if you run it through insurance, typically around $400 to $500. At our office, that same test is $13. And so why this isn't the norm for patients, like, oh, we'll do a pap smear and make sure you don't have cervical cancer, this like slow growing, typically we catch it in time, but ovarian cancer that we typically don't catch until you're dead, we won't do anything. It's like, why is this not a test that's run on every single female? It doesn't make sense to me.
That's true. Most of the things, these kind of things are never talked about in the mainstream media. So that's very important. And another thing that I know your practice does is HRT, or bioidentical hormone. Yeah, that's another thing that a lot of people cannot connect. Like DPC can also offer something like this, because they would still think they can go to their OBGYN and things unfortunately still don't get sorted out. What would you like?
Yeah, so HRT is huge right now because women are finally coming out and be like, we aren't just going to suffer through this thing called perimenopause for 15 years and then let our hearts die because we don't have estrogen left. So there's so much more research being done on women's health, finally, just like a century late, no big deal, that it's very important to stay up to date on the current research. But unfortunately, if you're seeing 30 patients a day in the regular insurance-based world, you don't have time for that. And so many of our patients go to the gynecologist and they're complaining of perimenopausal symptoms. And so the gynecologist says, fine, do your hormones, but they don't tell them what day of their cycle they should be doing them on. And then they get them back and they say, oh yeah, everything's fine. Well, that's because your estrogen can be fine if it's from 4 to 300. Depending on where you are in your cycle, right? And so these poor ladies are just suffering through these terrible symptoms, and they don't have to. But unless you find a healthcare provider who has gone out and done the education, they aren't going to know how to fix it because it's just not mainstream stuff. There is yet to be a testosterone dose that is FDA approved for women. It just doesn't exist. It's not out there. And so you have to find a provider who's willing to find that information, to work with the local compounding pharmacies, to talk with the pharmacist, because guess what? I don't know. I don't know dosing on that stuff. Like, that's not my jam. I can tell you when you need it. But as far as like really dialing it in, I call my neighborhood pharmacist all the time. I'm like, hey, I got this lady. Here's what's going on. What do you suggest? And so it's really that collaboration that I think is really key, but also women have to be advocates for themselves. If you don't feel right, your labs are not the only thing we should be talking about. We have to talk about patients' symptoms. If everybody could just be treated by lab work, then ChatGPT can do my job, but that's not the case. And so we have to take the whole person into account, and you have to make sure that you are advocating for yourself.
That's true. And thanks for explaining everything. And what I'm really hearing is like DPC, it shifts the focus back to relationships, time, and access, and things that feel increasingly rare in our traditional healthcare system. Next, I would like to talk about burnout, injury, or anxiety, and emotional exhaustion as a clinician. And I was reading an article a few days back in the UCSF Health Force Center, and about some 46% of healthcare workers, they were experiencing burnout back in 2022. And according to that probably costed our economy $4.6 billion.
Yeah.
From your experience, how does the DPC model impact the clinician burnout, the mental health, and what changes when providers finally have the space to practice without the constant time pressure?
Yeah. So there's so many things that go into this. Number one is the number of patients that you're responsible for. So your average primary care provider in the insurance-based world is responsible for 2,500 to 3,000 patients. That is
Mhm.
absurd. There is no way you can know everything about those patients that's necessary to take good care of them. And so you're constantly trying to relearn things, read through their charts, be like, okay, I haven't seen this person for 6 months. I don't even know their name, let alone what medications they're on. And so it gets really difficult. Where in our world, our providers have no more than 400 patients. Now, 400 is still a lot, but it is much easier to be like, oh, yeah, this is Jane. Jane constantly has this problem. And so let's try to fix this, right? It also allows us to follow up with our patients when they get lost. And so that prevents a lot of like mental overload. The second part is the paperwork side of it. So
Mhm.
much, more than 70% of a healthcare provider's day is spent doing paperwork. And it's because medical notes are required to be so in depth to prove to insurance companies that we did our job, that we can code for the level of service that we coded for, that it takes everything away from patients and puts
Mhm.
everything onto paperwork. And that's not relationships, right? You can't sit and be like, let me be over here typing my note while I'm asking you questions. Like that's not real care. Unfortunately, the healthcare world also incentivizes you to do things that you typically wouldn't, and it has to do with the billing and coding world, right? So as an employed provider, I have to answer to the guy in the C-suite. I'm going to tell you
Yeah.
that guy in the C-suite has never laid hands on a patient a day in his life. He has no idea how to take care of patients, yet he wants to tell me how to do my job. So not only do I have this guy in the C-suite, but I also have 72 different insurance plans that we accept. And I have to know what they deem as preventative and what codes they will cover for lab work. Because if I send my patient and I don't have the right code on there, then they get an exorbitant bill and they get mad at me. But how I'm supposed to know all of that information and also all the medical information is absurd. The amount of
Ex-
times that healthcare providers have to get on the phone to convince an insurance company that the test they ordered is necessary is absurd to me. Like why we need prior authorizations to do any of it,
Yes.
it makes no sense. Like, no, I'm the one with the degree. I'm the one who has the license. Why are you, the insurance company, telling me what my patient needs or doesn't need? And so much of providers' time is spent on administrative crap. The other
Ex-
problem is in a
Mhm.
healthcare system, the only person that makes money is the provider, which is why that provider's in the back and can't be talked to. Because if that provider's not seeing patients, they aren't making money, which is why then the healthcare provider has to make enough revenue to pay for the medical assistant and the receptionist and the biller and the coder and the medical office manager, right? And has to keep the lights on, right? Yet reimbursement year over year has continued to go down. The same patient that I saw in 2000, I got paid $14 more per visit by Medicare than you did in 2025. It's a 25-year difference, and $14 per patient per day comes out to about $70,000 a year that I now am not getting because reimbursement has gone down. And so not only is it way more paperwork and
Mhm.
overloaded with patient requests, so healthcare is not getting any easier. Every day, we're getting new studies, new information, new medications, new things that we're supposed to be able to learn. So now I have to see 30 patients a day. I have to appease the insurance company. I have to appease the guy in the C-suite. And I have to stay up to date on all of the things for my patients. And you expect me to do this in 40 hours and then go home and be a mom? Yeah, not happening. It's just not
Uh-huh.
happening. And
That's true.
so DPC gets rid of the paperwork, the overload of patients, gets rid of the guy in the C-suite, and gets rid of the insurance crap. And so then it lets me do what I'm good at, and that's take care of patients.
That's true. That's true. Thanks for explaining it so honestly.
Sorry for my rant.
Yeah, no, that's fine because at least, people understand what actually the problems. And at the end, when people come and they say that the provider is not taking care of us, it's not actually the provider, it's our system that's broken. So in the end, I would say the fault is not on the providers, it's on our system. And when clinicians are always operating in a survival mode, it not only affects them, their families, but also the quality of care patients are receiving. Another thing I would like to talk about is your book. Your book was DPC Dream Job or Total Disaster. That really caught my attention because it is honest and there's no sugarcoating there, right? For clinicians who are, yeah, and who are intrigued by DPC but are scared to take lead. What are the biggest myths or the hard truths they need to understand before they make that transition?
Yeah, owning a business is hard, right? You could be the best healthcare provider that has ever walked the planet. But
Yeah.
there's a difference between taking care of patients and running a business successfully. And so you have to learn that it's not it's not impossible. You just have to learn how, and you have to be willing to. I think one of the scariest things for people is marketing. And it's because as an employed healthcare provider, you don't have to market anything, right? You don't have to tell people, oh, come see me, come see me. In the direct care space, nobody is sending you patients. They have to know you exist. They have to trust you. They have to know that you're the expert in the field. And you have to convince them that you are worth their value. And so it's a constant game of proving your value and taking care of people. Now, you're really good at taking care of people, so you can prove your value, but it takes time and education. One of the biggest downfalls of direct primary care is people don't know it exists. I'm going to guess at least 50% of the people that listen to this podcast have never heard of direct primary care before. And
That's true.
until it becomes as common knowledge as Walmart, we're going to
Mm-hmm.
continue to struggle as clinicians trying to open these practices, because not only do we have to educate people, but we also have to be top of mind, but also they have to have a catalyst to pull the trigger. Most people aren't just like, oh, direct primary care, that sounds great. Let me just start paying you money. I don't need anything right now. I won't see you for 6 months. So you just keep my money. Nobody does that, right? It's okay. I know about you. I know about this system. And now I'm sick and I need to be seen. Or now I need my medication refilled and I don't have anybody to do that. And
Mm-hmm.
so there's just a lot to go into it. And then also as a healthcare provider, you typically have a really big heart. Most healthcare providers go into healthcare because they want to take care of people. They love to see people get better, but you also have to be able to run a business and make payroll. And so not giving away your services for free, setting
Yeah.
boundaries is so important, especially because you're trying to prove to these people that they value you. That means you could let them walk all over you. And I'm speaking from experience where you want to be always available for these people so they never leave your practice. You'll take any patient because anybody who's willing to pay the bill is good, but not all patients are good. And so you really have to learn to set boundaries and stand up for yourself. And that is really hard for a lot of healthcare providers. So those are a lot of the things I go into in the book. A lot of the questions I wish I knew the answer to, like, what does this life look like? How can I be available to my patients all the time and take a vacation? How can I do these things, right? And so the book is really should you? Are you the right person to open a direct primary care space? Can you be a healthcare provider and an entrepreneur? Not
Yeah.
all can, and that's okay. But my hope is that people will read this and we'll get all of the best providers to become DPC providers.
That's that's an amazing answer, and I really appreciate the honesty. Um, and I know DPC can be incredibly rewarding, but it still requires an intention, clarity, support, and the biggest thing you mentioned was, how to put yourself out there and
Mhm.
making those boundaries. And you talked about boundaries as a healthcare provider, how hard you had to work on your mindset to create those things. Because obviously we always learn from our failures, right? What was the
Mhm.
biggest hurdle that you had to overcome?
Yeah, it was letting people break the rules, but I had to set the rules first, right? So as you open a practice, you just want everybody and anybody to come in the door. And so you will just offer anything of yourself. But
Hmm.
unfortunately, when you get 200 patients and you've done that, they're going to ruin you. You're going to end up right back where you were in the world of burnout, but it's just going to be different because they're going to be needing you because they do have access to you. They can send you a text message. Now, ours goes through a system. It doesn't go to my personal text message. And so in the beginning, I was like, oh, I will answer people at all times of night, right? Like they can call me at 2 a.m. Well, what I realized is that was making me so exhausted that I wasn't available for my patients during the day.
That's
And
true.
I would make exceptions to things like, oh, I'm open from 8:30 to 4:30, but oh, you need an appointment at 7 a.m. Yeah, sure, I'll come in early for you. And then they wouldn't
Okay.
show up. And it's like, yeah, no, like I'm here to accommodate people, but also I have rules, right? And I would never expect somebody to do that for me. And so why it's vice versa, I don't understand. Also, this is not concierge medicine. Nobody's paying me $1,200 a month. If you're paying me $1,200 a month, then maybe I'll answer the phone at 2 a.m. But do you know what I can do for you at 2 a.m.? Tell you to go to the ER. That's it. That's all I can tell you to do. And so, especially as we have expanded to multiple providers, we've had to set very clear expectations because people take call at different times. And so they're not always going to get their provider. And if their provider is just letting them do whatever they want, and then they're not getting it if their provider's on vacation or something like that, then they get really angry about that. Where if we all have the same rules and we all abide by the same rules, then we can move forward. And I will tell you, people appreciate boundaries as long as you set them and you stick with them. It's only when you break them that then they expect you to break it again. And when you don't, that's when they get angry. And so we have a very, very clear rule of your poor planning is not my emergency. Yes. And so if it's not an actual emergency that just happened, I'm sorry. Yeah. I'm not stepping away from dinner with my family to deal with your issue that's been going on for 5 days and you couldn't call me during normal business hours. Sorry, I'm not doing that. And so you just have to set those expectations with people and they will respect them.
That's true. That's true. I totally agree with that. And you mentioned about different locations. Can you tell our provider, like our listeners, which locations do you have in Austin?
Yeah, so we're in the north and east sides of Austin. So we have one office in Cedar Park. We have one up in Liberty Hill, which is in North Austin. And then we have one out in Thorndale, which is on the very east side of Austin towards College Station.
Mm-hmm. Perfect. And you do offer telehealth visits all over
Absolutely.
Texas? Okay.
We are limited to, we can only take care of patients in the state of Texas. And that is a state law because we are licensed in the state of Texas. As long as our patients have a Texas residence, then we can take care of them. So if they're traveling out of the state, then we can still take care of them. We can send prescriptions across state lines with the exception of Control 2 medications, which is a federal law. But yes, we do a lot of telehealth. So we have patients who live in Houston and we have some that live in Odessa. And so obviously we don't get to lay hands on them. Sometimes they miss out on some of the benefits of what we do, but they see the value of it. And so they keep coming.
Yeah, that's perfect. And thanks for explaining everything. I appreciate everything. And now, before we wrap up, Monica, at the end, I always love to end with rapid fire questions. They are short questions and just answer with the first thing that comes to your mind. What is the hardest rule you had to learn to enforce as a business owner?
That I am valued and I deserve to be paid.
Okay. The biggest misconception clinicians have about DPC?
That they can't do it.
Okay. In the morning, do you prefer tea or coffee?
Coffee all day long. Not just in the morning, all day long.
Oh my God. Okay. What is your one morning ritual that you never skip?
I mean, brushing my teeth, but really it's drinking coffee.
Okay. What's something that has surprised you in all of these years yourself as a business owner?
My personal growth, to be honest. I am a completely different human than I was 7 years ago when I started this. And I think it's all been for the better.
Perfect. What part of you yourself came back once you stopped practicing on a clock?
I became a human being that respected myself again and found that I have worth in myself.
That's amazing. One last question. What, if you could tell your younger self one thing, what would it be?
Oh, there's so many things. Probably to stop chasing goals that aren't my own and stop chasing what I think other people believe to be success and not what I truly believe to be success.
That's amazing. Thank you so much, Monica, for this conversation. This has been truly insightful. Your journey is such a powerful reminder that healthcare doesn't have to feel rushed, just transactional, or it's misaligned with our values. And thank you to all of our listeners. Thanks for tuning in. If you enjoyed today's episode, please don't forget to subscribe, share, or leave us a review. Until next time, take care and stay balanced.
Thank you.